Hi, my name is Saesha Kapoor, and I'm the co-president of Be Smart Don't Start at South Forsyth High School. And I interned with Tammy this summer, and she offered me the opportunity to go to the CAD/CAM major conference. One of the main topics we focused on there was the Strategic Prevention Framework. And in this presentation, I'm going to be telling you a quick overview of what that is. The Strategic Prevention Framework is made up of 5 main parts: assessment, capacity, planning, implementation, and evaluation. You can remember these 5 parts through apple cherry pie. And in the middle, you'll notice that there's sustainability and cultural competence. So let's go through each of these parts and see what they're about. So assessment is, what is the problem in my community? You're going to analyze the needs of your population, and you're also going to see what resources do I have that may be able to fix it. Capacity is all about what tools can we use, what resources do we have to most effectively solve a problem. When you think of capacity, think of your toolbox and think of what resources I can put inside my toolbox and pull out to use in my strategies. Planning, you're just going to make a strategy outline like you would do with any essay. Just make an outline. Who is going to be doing what and when will they be doing that? Implementation, going to implement your plan of prevention programs, activities, advocating. Evaluation is just overall reflection on areas that need improvement. You can look at your strengths in your plans and your weaknesses in your plans. Sustainability is making sure your prevention plan is effective no matter how long it takes. If it takes a month, it could take 3 months, it could take a year, but you want to make sure your end result is something of what you were hoping for. Cultural competence is making sure you have people from different groups, different backgrounds, different ages, and this makes sure that the community is well represented. Our council has many different sectors, and there are many different chapters of people different ages and jobs, so we do effectively represent the community. And we're going to look at the first step, which is community assessment. And there are 5 parts to a community assessment. Your first step is to define your community and describe it. So you're going to define your boundaries. What are you going on a school district level? Are you going on a state level, a county level? And you're going to define those boundaries. And within those boundaries, you're going to take out demographic information and geographic information, anything that might help you. Needs assessment, you're going to look at your hotspots. Where is my problem occurring? Again, who is doing what where? Your hotspots can be the parking lots of a certain mall. It can be a certain high school or a certain middle school. Your resource assessment, again, think of your toolbox. You're going to look for places, people, or things that can improve the quality of your community. Play to your resources. Community history, you're going to look at your old history, economic history, old laws, see if there's anything that may be contributing to your problem, and think about, is there something I can do to change it? And taking all of these steps and all of this information, you're going to create your problem statement. Your problem statement is just one concise statement. In this, you don't want to blame people. You want to focus on one problem and make sure to reflect your community concerns. So an example would be underage drinking in Forsyth County. So now I'm going to go into the specifics of your host, agent, and environment, and how you can use this in your problem statement to further help solve it. So one thing, just to make sure you understand, is you have a substance and you have a human. When both of these come into contact, that is when it becomes a problem. So let's say your substance is called an agent. So it can be alcohol, it can be different types of drugs. Your human is your actual host. And this can be specifics like specific different age groups. And your agent is going to interact with your host. So alcohol is going to interact with your humans inside of what we call the environment. So let's say in this example, the agent is alcohol, your hosts are high school students, your environment is house parties. You can put this all into a problem statement. High school students are drinking alcohol at house parties. and you can break it down to see what actions could I take to help solve this. So if we're just going to take the agent, we're just taking alcohol, you can eliminate alcohol, you can criminalize all alcohol. If we're just taking the high school students, you can educate youth about alcohol dangers, punish youth caught drinking, provide screening and treatment to those caught. If we're just looking at the house parties, we can raise alcohol prices, patrol areas where youth consume alcohol, and make sure to lock up alcohol inside of the house. And then we're going to talk about categories, which are called risk factors or but whys. And these are categories that you can place reasons for your problem occurring under. So there are 6 of these. You have retail access. This all has to do with stores where things are being sold. Favorable attitudes by youth or adults. An example of this can be youth favorably look upon e-cigarette smoking within peer groups. Laws and enforcement, think of punishments. Are punishments strict enough? That sort of thing. Price and promotion, I think a good example of this would be e-cigarettes promote themselves within different flavors, and that helps contribute to youth being attracted to e-cigarette smoking. Social access is, do you have an older brother that gets alcohol for you? Do you have adults within your household that get alcohol for you? That's social access. Community norms, is it normal in your community to be seen smoking? Is it no one's going to say anything to you if you are? So an example would be one reason for underage drinking can be places that do not card. This would fall under retail access. Local conditions. Local conditions are specified versions of your problem statement. What do you see in your specific community? It must be specific, that's related and unique to your community. I could say drug exchange is happening in the West Hall of South Forsyth High School. It's very specific. Most people that do not go to South would not know where West Hall is, and that is what I want. It must be identifiable. Could I take a picture of it? Which I wouldn't do, but can other people see it by looking around? It must be actionable. Is there something that I can do something about? So if we're going to put this all together, let's say my problem statement is youth using e-cigarettes in Forsyth County. My risk factor is favorable attitudes by youth, and my local condition is Forsyth County middle schoolers see vaping as a way to get into groups because high schoolers do it. Notice I said Forsyth County middle schoolers, which is kind of my specification about youth, and that's what you want in your local condition. Once you have all this information, you have your problem statement, you have your categories of reasons, your but whys, and you have your local conditions. You're going to come up with 7 intervention strategies to help solve one local condition. So for each local condition, you're going to have 7. So these 7 are providing information. This can be educational presentations, workshops, handing out brochures with information inside, enhancing skills. It can be conferences, seminars designed to increase the skills of participants. It can be training sessions, providing support, having support groups, creating opportunities to support people who participate in activities that reduce risk. You can provide alternative activities, enhancing access and reducing barriers, improving systems and processes to increase the easy ability and opportunity to utilize those systems. Changing consequences. This has a lot to do with law enforcement. Having rewards, public recognition, more taxes, more fines, more citations. Changing physical design. You're basically going to be changing your landscape. This can be using signs. This can be parks. Modifying and changing policies is very a legal aspect. If you're looking to have a policy change or talk to a legislator, you're going to be looking for a formal change in written procedures. So let's look at an example. Let's say my problem statement is underage drinking in Alpharetta, and my but why is retail access. My local condition is liquor stores not carding kids under the age of 21. Where I said liquor stores, you would actually put the specific store, but because I don't live in Alpharetta, I'm not sure what those might be. If we're looking at the 7 intervention strategies, providing information, you can educate vendors about the penalties of not carding, building skills, have law enforcement training on implementing compliance checks, provide support, assist law enforcement with compliance checks, access and barriers, require all patrons to provide valid ID to purchase alcohol. Incentives or disincentives, this would be a disincentive, is having citations for vendors selling to minors. Physical design, actually install cameras within the store. You're changing your physical landscape to monitor staff compliance with carding policies. Policies and regulation, pass ordinance for compliance checks. And you would put this all into what we call a logic model. And in your logic model, you can see you have a problem statement, a risk factor, a local condition, and you have your 7 intervention strategies, or at least try to have 7 for your local condition. And the whole purpose of having this framework set is to be able to effectively solve specific problems and just take small actions towards that.